Start.
A very good morning, all of you. I, Dr. Shreyas S., Organizing Chairman of Viveka Prastuti, Sparda, cordially welcome all of you to the first ever virtual online paper presentation for PG scholars. With the support of the management and able leadership of our principal, Dr. I.B. Kottur Shetty sir, who is also the patron of this Viveka Prastuti, we launched our program on 4th of August 2020 with the Department of Kaya Chikitsa for 2 days, and yesterday the Department of Dravya Guna. Today and tomorrow is our program, that is the Department of Prasuti Tantra and Stri Roga. So let's start our program by invoking the Lord's grace. For this, I request Dr. Sharada, one of the organizing chairman of Viveka Prastuti, to do the needful.
Shri Guru Bhyo Namah Harihi Om. I request all of you to join me in my prayer. Om Namami Dhanvantarim Adidevam Surasurairvandita Padapadmam Loke jararubhayamrityunasham Dataramisham Vividhaushadhinam Dhanvantarim Ramanatham Ayurvedam Vande Bhusharam Shanti Shanti Shanti. Over to you, please.
Thank you so much, madam. So let's start our program. So as you all know, we had shared our flyers everywhere, and most of you all are aware that today we have two eminent chairpersons from the nation. One, Dr. Mamata KV. So madam is a professor and HOD from Udupi. The second chairperson is Dr. Asha Sridhar madam, professor and HOD from Kerala. So I ask Dr. Naveen to introduce our speaker. Today we will be having one keynote address by Dr. Mamata KV. So I ask Dr. Naveen to introduce our keynote speaker for today's session.
To give introduction about the well-known personality in the field of Ayurvedic Prasuti Tantra and Stri Roga, that is Dr. Mamata KV Madam. Madam is a medical superintendent and professor in the Department of Prasuti Tantra and Stri Roga, SDM College of Ayurveda, Udupi. Madam has completed her undergraduation from Ayurveda Mahavidyalaya, Hubli, and post-graduation from in the Department of Prasuti Tantra from BHU Varanasi. Madam has also done PhD from NIA Jaipur, and Madam has also done certificate course in Diploma in Yoga and Diploma in Yoga from BHU Varanasi. Madam has got several awards. If I list a few, gold medal in 4th year BMS awarded from Karnataka University, awarded as a young scientist in Kaumara 2006 International Seminar held at SDM Hassan, awarded as outstanding alumni by Alumni Association Ayurveda Mahavidyalaya Hubli. Madam has guided more than 32 dissertation and 1 PhD work, and guiding 2 PhD works at present. Madam is involved in several research projects. One among them is 13 lakh funded by RGHS study of on PCOS. Madam is actively involved in public health programs and delivered more than 400 guest lectures and given several talks in radios and television. Madam has published several research articles and took part in several national seminars, workshops, and CMEs as a resource person. Madam is actively taking part in running the labor room of SDM College of Ayurveda, Udupi. Madam has several served as chairman of scientific committee of several national and international seminars held at SDM College, Udupi. Thank you, sir. Thank you for giving me the opportunity for giving introduction of Dr. Mamata KV, madam.
Thank you, Dr. Naveen. In fact, you made it very brief. It was a strict order from our speaker to make it as brief as possible. Though there were several points, we somehow tried to make it as much short as possible. Thank you so much, Dr. Naveen. Yeah, now let's not waste time. We'll begin the program immediately. I also take this opportunity to welcome our another chairperson, Dr. Asha Sridhar, madam. Welcome, madam. And I also welcome one of the organizing chairman, Dr. Sashikala B. Bani, madam, who will be with us as our technical helping from the college, Ayurvedic Medical College Road. Welcome you, madam. Okay, so now Dr. Mamata, madam, we want to hear few words from you regarding the Viveka Prastuti is for the competition, and also about the topic, the subject which we have chosen for the speakers, for the presenters today.
Thank you, Shreyas. Good morning, respected principal sir of our college. Am I audible?
Yes, you're audible, madam.
Okay. So, respected principal sir of Rona College, all the staff, students, Dr. Asha madam, and all my viewers. Rona College is in recent days making a lot of good works. One among them is Viveka Prastuti 2020. Really, those who are missing paper presentations, of course, we had a lot of seminars or webinars rather, where we used to present. But this is a very good opportunity where students also can present their work through virtual presentation. And I really congratulate the departments of Prasuti, Dravya Guna, and Panchakarma who are involved in this Viveka Prastuti. And I also congratulate the management, principal, and the staff who are organizing this kind of webinars or virtual paper presentations. Moving on to the topic, of course, in Prasuti Tantra, you have selected a topic which is very worth working on it now at this current scenario. I need not mention what are the causes which are leading to infertility, because all of us are well aware that there are so many changes in the lifestyle, there are so many changes in the food habits, what we are having in recent days, and all these are contributing in a collective manner in reducing the fertility and increasing the incidences of infertility, not only in India, in the entire globe. Right. Now, in this at this juncture, if we retrospect ourselves and if we analyze what is our role, what we can do in solving this burning issue of the society, and what would be our efforts to publicize, uplift, and to reach people at this changed scenario of infertility treatment. We all know that there are mushrooming of centers with the claims that assisted reproductive centers, we treat this much, we treat this, we treat that. And you are also well aware that what is the financial burden these institutions are throwing on the patients who are coming there with an intention of having motherhood. Right. So if we analyze ourselves, what are our strengths, where we are lacking, and where should be our aim, and where should be our disha to which we have to progress. The first and foremost thing in the infertility concept is Nidana Parivarjana, any disease, when we take an elaborate detail or history of a couple of infertility, we come to know set of nidanas which are leading or which are causing either leading to infertility. In a way, infertility is not a vyadhi mentioned in Ayurveda. Rather, it is the complication explained in all gynecological disorders, in all Artava Vyapats, and everywhere wherever there is involvement of yoni in the Samprapti of any other disease also. So Just Nidana Parivarjana of that particular Yoni Vyapat, Artava Vyapat, Asratara, or whatever it is the first and foremost thing which most of us clinicians will forget. We change the prescriptions quite now and then, but we never mind or we never bother to change the lifestyle of the patient, which is giving rise to this problem of infertility. Second thing is concept of Shuddhartava is a very excellent tool. What acharyas have given to us. Earlier, there were no papers available on this topic, or there were no research works being carried out on what is Shuddhartva. Right? Except the references in Ayurveda, in researches, we never found such kind of references in the modern gynecological field. But now, if you search, they talk about a lot of proteomes, more than 5,000 proteomes present in the menstrual blood, through which the consistency, color, and the appearance of the menstrual blood changes. And based on the concept of this proteomes, they are even thinking of diagnosing the diseases of gynecology, diagnosing the gynecological disorders without going for other investigations or thinking of some menstrual blood being used as a diagnostic tool. So the concept of Shuddhartava, whatever acharyas have given us, is a powerful tool in tackling the problem of infertility. Once we identify where is the dushti and what is the dosha which is causing that particular dushti, and if we can effectively control this dushti of Artava, and if we can bring the normalcy of or the Shuddhartava Lakshanas again, that itself is the treatment for infertility, and many couples may be blessed with a child once we bring back the Shuddhartava Lakshanas in that particular lady. Coming to the Shodhana Chikitsa, in recent days there are so many papers being published on efficacy of Shodhana in IVF centers. So in IVF centers, before they plan for any assisted reproduction, it is a trend in some of the cities that the couples are being sent to an Ayurvedician, or many centers do have their own Panchakarma therapists or Panchakarma physicians who will be conducting this routine Shodhana Prakriya to the couples who are planning for pregnancy. And after that, when they go for assisted reproductive technologies, assisted reproductive methods, they found a very much hike in the incidences of conception in couples who underwent Shodhana before going for this procedure. So, a very good effort should be done from Ayurvedic faculty, we gynecologists, where we can very well document, the incidences of success or the percentage of success with and without Shodhana, with assisted reproductive technologies. So, this is one aspect of it. And of course, regarding this, reliable and very good data should be produced on which we can take up further works on a large scale. Then coming to the Shamana Aushadhis, described in Ayurvedic classics, we get a book full of prescriptions. Rather, we get hundreds of preparations which are said that if you consume this particular combination, if you consume this drug, definitely a sterile lady will also be blessed with a baby. But there is no very specific conditions where you can prescribe this particular drug. For example, Ashwagandha, Kshirapaka. They say that Ashwagandha Kshirapaka, if the lady consumes, she can definitely be blessed with a child. But in what conditions this Ashwagandha works? In what conditions Nasya works? In what condition which Uttarapasti works? In what condition this particular combination works? And what is its impact on the body, whether it improves the endometrial receptivity, whether it works at the immunological level, whether it is useful in the pelvic, reducing the inflammatory markers in the body. So where exactly and how exactly a given drug or a given combination works, that has not been assessed properly, or even if it is assessed, it is at the individual level. It is not published very well. It is not useful. Every person is like doing his own efforts from A. And by the time he finishes his career, he will be somewhere in M and etc. Instead, if a document is available on this, probably instead of once again starting the efforts from the other research workers can start their work from M and N, then they may reach XYZ very easily. So such an effort should be done collectively from the faculty of OBG of Ayurveda. And for this intention, I suggest probably a central body which which governs, which documents, and even which can think about mobilizing the funds required for multicentric large scale studies on infertility, taking up different topics at different places. So this, if we can bring large funds from different some funding agencies, different sources, because all the investigations of infertility cost a lot to the patient. And these advanced investigations like interleukin levels or endometrial receptivity levels, they are in such a they will be burdening the patient in such a way that probably it may be difficult for a middle class family to establish, I mean, to spend for these investigations from their pocket. And moreover, when we are doing, they need only a child, right? So when we are doing it for establishing our results, it becomes our duty that we see that we provide fund to some extent as the cost or assist in the expenditure aspect of the infertility treatment. So if we can dream about something which a central body in the department or in the faculty of specialty of obstetric and gynecology, which looks about the funding from different agencies, it governs the studies, it controls the studies, it sees about genuine study is being carried out at a different various aspects of infertility with its experts at various centers. That would be a very good work, I believe. And moreover, my dream for this era and for future generation, which I'm transferring, is to have an assisted reproductive center which is run totally by Ayurvedicians, of course, with the technical staff members who are expert in their own fields, right? But whatever the assessment of the patient, whatever the drug we give in treating this, instead of all hormones, all injectables, it's my dream to have Ayurvedic drugs replacing all these modern drugs which are and which are believed to have a lot of complications, a lot of unwanted side effects in the couples who are intending to be mothers, right? So with dropping this dream in the brains of future generation, I would also like to add that if Gandhari can process the tissues into a fetus and then into a child at that era, why can't we have this dream now in our well-equipped centers, well-equipped colleges? With these words, I wish all the best to the paper presenters and I hand over the mic to Shreyas. Thank you.
Yes. Thank you, madam. Thank you so much. Hopefully, we also wish to see your dream, our dream, to to be fulfilled very soon, at least in a decade, within a decade, hopefully.
Yes.
And you were also mentioning that research is a very integral part in any postgraduate study. And in fact, research is what is needed now, the documentation and the presentation. You said from A to Z, when we have to go A to M, we would have done. And again, going back without documenting, we'll be going from A. If we put M, so then we can go with next alphabet. Right said. Likewise, we have the main motto of our program today is also the same, so that our research scholars can start doing at least a single case study, document it, and then make a next level study of the same documents. So let's not delay much more, and requesting both the chairpersons, you would have given the score chart, madams. So both of you can mark your comments and note the any comments in the end. And after the vote of thanks, while vote of thanks is going, I would be contacting you for the results. And meanwhile, you can have your views also upon all the 8 presentations. So let's begin with the presentations. All the presenters, an instruction, kindly mute everybody now it will be mute. The microphones will be muted by all of us, also the video. Only the presenter will be on with the video, and the chairpersons, even your video could be on if you feel like. And so there will be 3 people on the screen, that is 2 chairpersons and the presenter. Rest all kindly mute and stop the videos. So let's begin the program. Bani madam, can we start?
Yes, sir.
Yes. The first presenter, Dr. Deepthi PV. Dr. Deepthi PV?
Yes, sir.
Yes. Now the screen will start sharing.
Am I audible?
Yes. Deepthi, wait for a minute. I will say you to go. Yeah,
Okay,
you're ready to go. Go.
Okay. A warm good morning to one and all, respected personalities and fellow presenters listening to National Level Isparda Scientific Paper Presentation, Viveka Prasuti 2020. Myself, Dr. Deepthi PV, a final year PG scholar, Department of Prasuti Tantra Striroga, Government Ayurveda Medical College, Trivandrum, Kerala. Let me salute the Apurva Vaidya. Ragadirogan, Sadadanushaktan, Asheshakaya Prasudanasheshan, Outsukya Moharadhikanchagana, Yo Apurva Vaidyaya Namostu Tasmi. With all your permission, I am starting my presentation on effect of Ayurvedic treatments on diminishing ovarium reserve, DOR, a case study. Sir, first slide, please. Okay. Before going to the details of the case, I would like to give a glance of DOR. Shreyasi Praja. Infertility is a global issue affecting in 6 couples wishing to conceive. Diminishing ovarium reserve is the loss of normal reproductive potential in the ovaries due to lower count or quality of remaining eggs. Incidence of DOR range from 30 to 45%. The major causes include advanced age, resistant ovary, premature ovarian failure. The clinical features includes short and irregular menstrual cycles and infertility. The diagnostic criteria were serum anti-Mullerian hormone, that is AMH, and antral follicle count, that is AFC. A woman undergoing IVF with DOR has a poor success rate. Ultimately, the couple is left with only an option of IVF with donor egg. Next slide, please. Okay, coming to the Ayurvedic concept of DOR. In Ayurveda, DOR better compared to Dhatukshay Vandhya explained in Harita Samhita. In Dhatukshay Vandhya, there is a progressive decline in Dhadus, Ubadhadus, mainly Shukra and Artava, and fertility potential. The early stage, due to Agnimadhya, Resakshaya occurs, which leads to Artavakshaya, which is evident from a scanty menstruation, that is Alpada, absent or less number of follicle in ovary, that is Artavanasha. The treatment principles includes Labhovayohi Shastanam, Rasadinam, Rasayanam, Vritti Samane Sarvesha Vibarider Vibariyaha, Shinaha, Shukragari Kriya. The progressive decline in the proliferative capacity and the lifespan of you can hear the, I can view the slides, sir. The last one. Okay. The progressive decline in the proliferative capacity and lifespan of the cell can be rejuvenated with Rasayana. Next slide, please. Okay, coming to the details of the case. The 9 X's. Age of the patient, 30 years. Occupation, bank employee. Residence, Trivandrum. Date of admission, 28th December 2017. And date of discharge was 25th January 2018. IP number was 909. Presenting complaints: inability to conceive a viable child even after 5 years of her married life. Sir, it's last screen. Coming to the history of presenting complaints. Okay, sir, okay. She got married at 25 years, husband aged 30 years, which was a non-consanguineous marriage. She took many allopathic medications for her menstrual irregularities. She suffered from primary infertility and diagnosed as DOR after allopathy consultation and suggested for IVF with donor egg. The suggestion for undergoing IVF recommended by allopathic doctor was not convenient for the couple, and the doctor later referred the patient for Ayurvedic treatment. Next slide. Okay. Coming to the menstrual history, it was irregular and scanty. Age of menarche was 12th year. At duration and interval, only 1 to 2 day cycles with spotting, bleeding, 40 to 45 days interval. Amount was scanty, and she felt dysmenorrhea during the first day of the cycle, which was mild in nature, and her LMP was 5th January 2018. Coming to the medical and treatment history, she had a history of a thyroid dysfunction, and she took Thyronam 150 milligram for the last 3 years, starting from 2016 onwards. She had a surgical
Check the time, Deepthi. You'll have to go soon. You have only 2 minutes left.
She has a surgical history of laparoscopy for the small subserous fibroid in 2016. Personal history: diet, mixed diet, irregular intake, appetite weak, bowel irregular, heart disturbed, psychological status depressed and anxious, and general examination, it's quite normal. Next slide, please. Next slide. Physical examination, systemic examination, perspectivum and pervaginal examination were normal. Investigation. Coming to investigation, AMH level was 0.07 Ng per ml, which was done on 7 December 2017, and AFC count right ovary 2, left ovary 2, which was again done on 8th December 2017, and male factor were seminal factors, everything were normal. Come to the next slide, please. Okay, this was her AMH level. Next slide. Then coming to the treatment protocol, Udvartana with the Kolagulatadi Churna for 3 days. For Akni Dibana Pachanartham, Vaishana Churna 5 gram BD 3 days. Achasnehabana with the Sumara Krida starting dose 25 ml for 7 days. Abhyanga Ushmasveda with the Dhanvadra Thaila 3 days. Videjana with the Sumara Eranda 20 ml for 1 day, and advised to take the rest for 1 day. Then Yogavasti, in that Snehavasti with the Dhanvadra Thailam 120 ml, Kashayavasti with the Saptasarang Kashayam 480 ml, Shadavushpagalpa and which is 30 grams, Saidava 15 gram, and honey 120 ml. Uttaravasti was done with the Sumarakrida 50 ml for 3 days, and follow-up medicine Sumarakrida for 10 ml BD. Next slide. The result was on 5th April 2018, UPT was positive with fruitful outcome of the treatment, and her antenatal period was uneventful. She delivered a healthy female baby of 3.5 kg on 16th October 2018. These were the report, AMH and the first trimestic scan. Thank you so much. Thanking you all for your patient listening. Thank you so much. Have a nice day.
Thank you. Thank you, Dr. Deepthi. Let's move on with our next presenter, Dr. Srinidhi.
Hello.
Yes.
Am I audible?
You're audible. You can start once we start the screen share.
Okay.
We'll slide show it. Kindly hold on. You'll have to note the time because you have only 5 plus 1 minute. Okay.
Yes, doctor.
Yeah, you can start.
Okay. Good morning, everyone. I'm Dr. Srinidhi from SGV Ayurvedic Medical College, Bailhongal, Belgaum district. Today, I'm going to present a clinical case report on infertility with special reference to Kshetra Dushti. My guide was Dr. Sudhakar, SGV Ayurvedic Medical College. Next slide, please. Before starting the case history, I just want to briefly introduce about the topic. Infertility affects about 10 to 14% of the Indian population as per the Indian Society of Assisted Reproduction, where being unicornuate uterus is a congenital anomaly of Mullerian oogenesis. Studies have proved that there is 3% chances of infertility with unicornuate uterus. In Ayurveda, there is no direct reference, so we can correlate it with the Kshetra Drushti, and in this case study, the Shatavari Grita has been used, which is known as a female tonic, moistens dry tissues of sexual organs, enhances ovulation, prevents miscarriages, and prepares the uterus for conception. Next slide please. The aims and objective: to study unicornuate uterus being the case for infertility, to study the efficacy of Shatavari Grita Uttarbasti in Kshetra Dushti, to study the efficacy of Shatavari Gruta in Yoni Pichu in Bija Kshetra Dushti. Next slide, please. This is the case report. A patient with 31 years with well education coming from a middle class family was a housewife. Her Pradhana Vedana was anxious to conceive since four years. Anubandhi Vedana was Mansika Chinta and Vishada due to infertility. And Adhyatana Vyadhi Vrittanta was patient was married for 4 years, diagnosed with primary infertility with unicornuate uterus, comes to OPD for the Ayurvedic management. Her Rajo Vrittanta was 20 days cycle with 4 to 5 days flow with a normal bleeding. Prasava Vrittanta was she was nulli gravida, and Vayaktika Vrittanta married life for 4 years. Bowels and urine, bowel was mildly constipated, urine was normal, and Kula Vrittanta was nothing contributory. Garbha Nirodhaka Vrittanta was not used anything. LMP after she became pregnant was 17/9/2019. Next slide, please. Here, before her pregnancy, Ashtasthana Pariksha, Nadi 80 minutes per minute, Mutra 8 to 10 times, Shabda Prakrita, Sparsha Anushnitna, Drik Prakrita, Akriti Krishna, Jiva Alipta, Dashavida Pariksha showed Prakriti Vata Pittala, Vikriti Vakta Vikara, Sara Rakta Asti, Samhanana Madhyama. Pramana in view of height was 167 centimeters, weight was 56 kg, Satmya Sarvarasa, Sattva Abara, Ahara Shakti Madhyama, Vyayama Shakti Madhyama, and Vaya was Madhya. And Sthanika Pariksha showed Udara Pariksha in Darshana Prakrita, Sparshana was Mrudu and Prakrita, Akotana showed resonant, Prakrita Shravana normal bowel sounds, Yoni Pariksha in Darshana vagina and cervix found to be healthy and fornices were clear. In Sparshana, uterus were antiverted, anti-fluxed and fornices free. And these were the investigations where HB was normal, AMH was 2 ng per ml, the CBC counts were normal, platelets were 1.1 lakh, and HSG was done, which showed left unicornuate uterus with bilateral fallopian tubal block, for which was decided for histodiagnostic laparoscope, where the hysteroscope showed a cervical canal was normal, but the cavity was tubular but normal, and right ostia was not seen, but the left ostia was normal. And laparoscopy findings were left horn of the uterus was well developed, left tube was patent, left ovary was normal, right horn underdeveloped, right tube blocked, right ovary was normal. Next slide, please. Here we went for two Sthanika Chikitsas, beginning with the Uttar Basti, which was given by Shatavari Grita. The Purva Karma was done by Snehana of Balataila on the lower abdomen, back and lower limbs was given to the patient before each Uttar Basti. In Pradhana Karma, 3 to 5 ml of Shatavari Grita Uttar Basti for 3 days in one cycle on 5th, 7th and 9th day of the menstrual period was given with an interval of 1 day in between for 3 consecutive cycles from May 2019 to July 2019 with the consent of the patient. The oil and the instruments were autoclaved. The patient was placed in the operation table in a dorsal lithotomy position. The parts were prepared was cleaned with Panchavalkala Kota. The vagina and cervix were visualized with the help of Sims speculum and an anterior vaginal wall retractor. Uterine sound is done in Uttar Basti cannula already attached with a 5 ml syringe filled with Shatavari Grita was passed in the uterine cavity after making a head low position. The drug was pushed above the level of internal os with a constant force, but quickly to make the drug reach up to the tubes. Paschat Karma, the patient was asked to lie down on the table with a head low for 1 hour. The abdomen was fomented with hot water bag. Patient was asked to avoid very spicy food during treatments. Coitus was prohibited during the course of Uttar Basti. Next slide, please. Another Sthanika Chikitsa was Shatavari Grita Yoni Pichu. After 3 cycles of Uttar Basti, 1 cycle of Shatavari Yoni Pichu was done in August 2019. Procedure was patient was made to empty the bladder and was made to lie down in the lithotomy position using the Cusco speculum and clean.
You have 1 minute. You have 1 minute. You can.
Yes, and the pichu was inserted, leaving the tail of the pichu outside the vagina. Patient was asked to remove 3 to 4 hours after the urination. Planned intrauterine insemination was done on 28th of September. The procedure was same as Uttar Basti. Here the discussion comes as per the acharyas, vata gives rise for such anomalies in the garbhashaya wherein apana vayu is dominating. The shatavari grita uttarbasti help to pacify the vata and increase the elasticity to of garbhashaya. Similarly, snehana with shatavari grita yoni pichu also helped in shamanana vata. As acharya mentioned, sneho anilam hanti mrudu karoti deham malanam hanti sangam. Patient accordingly conceived and had an uneventful ANC and delivered a healthy female baby on June 1st, 2020 by cesarean, as it was a breech presentation. Conclusion: in the present case study, Shatavari Grita has been used as a Sthanika Chikitsa in the form of Uttarbasti and Yoni Pichu, which was found effective in treating infertility with Kshetra Drishti. Trial in larger sample is required to generalize the outcome. Next slide. These were the reports of the patient. Thank you very much. Thank you, Viveka Prasuti, for giving the opportunity.
Thank you. Thank you so much, Dr. Srinidhi. Let's go with the next presenter, Dr. Anita. Dr. Anita. Dr. Anita.
I am audible, sir?
Yes, you're audible. We can't see you, but.
Hello?
Hello.
Hello?
Yes, Anita, you can continue.
Hello? Okay. Thank you given for opportunity to introduce me. I am Anita. My goal from today's presentation is to help the treatment of Vandetva. Discussing today's topic, role of Hingwadi Tel Matravasti in Artavakshya Janit Vandetva. Slide, please. Introduction. Regular Raja Pravartana indicates normal reproductive life. Arthadusti is one of the main positive factors of Vandetva. Shuddha Artava is essential factor among the Garbha Sambhav Samugri. The prevalence rate is 12 to 15.3%. Prevalence rate according to ovulatory factor is 26 to 44%. Approximately 10 to 50% couples are impacted by infertility. Lakshana of Artavakshaya are yathochit kala adarshanam, alpata and yoni vedana. Hetu of Artavakshaya. Main hetu are the faulty diet habits, sedentary lifestyle, adulteration and hormonal use of food, inability to follow dinacharya, rutucharya and ratricharya. All these lead to vata prakopa. Next slide, please. Next slide, please. Aim of today's topic is to study the role of Hingwadi Tel Matravasti in Artavakshaya Janit Vandetva. While objectives are study of Vandetva, Hingwadi Tel Matravasti study of Artavakshaya and adverse effects of Hingwadi Tel. Next slide, please. Next slide, please. Methodology. The permission of institutional ethical committee was taken. Patient written informed consent is taken. Then 10% of Artavakshaya Janit Vandetva were taken according to inclusion criteria. Rugna Parikshan done with considering the following history: personal history, Vedana Vishesh, Purva history, Vivaha Ityas, Raja history, menstrual history, and some lab investigations done such as hemogram, BSL random, PFTs, and hormonal study. Lakshana recorded as special case record form. Next slide, please. Next slide, please. Samprapti of Artavakshya. Above mentioned all Nidan sevens occurs regularly, then Vata and Kapha Prakops occurs. Mainly in Vata Prakop, Apan and Vanvayu Dusti. In Kapha Prakop, Fleshmas and Sledas Kapti. Simultaneously, Pachak and Ranjak Pitta Karmahani occurs. Ultimately, all this leads to Alpa Pramana of Artav Utpatti and Alpa Pravruti of Artava. This Nyunatva of Garbhasambha Samugri leads to Vandetva. Next slide. Management. Hingwadi tel matravasti given from 5th day of menstrual cycle for 7 days for 3 consecutive cycles. This Hingwadi tel as per standard SOP is described in Bhaishacharali. Matra of the Hingwadi tel is 60 ml. Matravasti kal is Bhojanotter. Kal of Rutu Chakra is Rutu Kal. And Basti Pratyagaman Kal is 6 hours to 24 hours after administration of Hingwadi tel. Lakshana is recorded before treatment and after treatment. Duration of menstrual flow changes 1 to 2 days to 4 days. Interval between two menstrual cycles changes 60 to 65 days to 30 to 35 days. Pattern changes from irregular to regular. Quantity of menstrual flow changes from scanty, that means spot into 1 to 3 pads per day. Color of menstrual changes, no changes recorded during before treatment and after treatment. Vedna present before treatment while absent after treatment. Vandhyatva, approx 7 patients conceived after treatment. Next slide, please. Karmukatva of Hingwadi tel. Hingwadi tel contains Hingu, Kasi, Sendav, Shunti, Tejpatra, Chitra, Sarshap, Samudrafen, Karpur, Tankan, Sajjikshar, Yavakshar, Daru Haridra, and Sarshap tel. All these contents are Ushna and Vat Kapahar, and all these having Sri Pushpa Janan Karma. Matravasti producing Anuloman of Vata dosha and Shaman of Kapha dosha. Next slide, please. Observation. After 3 months Basti, we observe that out of 10, 7 patients of Artavakshya Janit Vanditva are conceived. 2 patients out of 10 did not get relief from Artavakshya and Vandyatva. During ovulation study, we observed that in these two patients, endometrial thickness was normal, but ovulation did not observed. In remaining 1 patient, hemorrhagic is noted in USG report after treatment. Next slide, please. Next slide, please. From this study, we conclude that Hingwadi tel Matravasti is beneficial for Artavakshya Janit Vandyatva. Constituent of Hingwadi tel helps in Samprapti of Artavakshya and it destroys Stotovegunya. From this study, we observed that Hingwadi tel helped in maturation and rupture of dominant Graafian follicle. Next slide. Thank you to chairperson, organizing chairman, secretary, and coordinator, and my guide, and all participants and listeners. Thank you. Thank you so much.
Yes, thank you so much, Dr. Anita. The next participant, next presenter, Dr. Atira. Dr. Atira Lakshmi.
Yes, sir. So can I start?
Yes. Yes, you can.
Yes. Respected chairpersons, dignitaries, very good afternoon to one and all. I, Dr. Atira, final year PG scholar from Sri at the college, presenting before you on the topic Importance of Stress Factor in Female Infertility, a case study guided by Dr. Sarda Patel, Professor and HOD, Department of PKSR, Sri at the college. Moving on to the introduction, the infertility says that the definition says that failure to conceive within 1 or more years of regular unprotected coitus. So the statistics in India says that 5 million couples suffer from infertility. It is creating a social problem. So the important factor which we have to understand here is the find out the causes and other factors which is leading to infertility. So in Ayurveda, we know that Ritu, Kshetra, Ambu, Bija are the main 4 factors which is needed for conception. So we can understand that the abnormalities in Vata, Shadbhavas, Ritu, Kshetra, Ambu, Bija, which will be leading to the infertility. Along with these factors, one more factor which is important is the pleasant and calm mind. So that is rightly said by Acharya Charaka as Saumanasya Garbhadhara. So let us understand of Saumanasya Garbhadhara. 32-year-old female, the marital life of 7 years, reported to open with the complaint of repeated conception of regular and unprotected coitus since 3 years. And she had also failed IUA 2 times. Next. Coming to the aims and objectives, to understand the importance of stress factor in female infertility, to evaluate the efficacy of therapeutic line of treatment in infertility with a special reference to stress factor, and also to establish the importance of some. So to plan a treatment, we always have to diagnose it properly. To diagnose, we need to find out the proper cause. And to find out the proper cause, always we need a proper history. In infertility, it is very important to understand proper history. So to this case, we can understand she had irregular cycles. With respect to coitus, there was no problem. And in family, there was no relevant family history. When we understand the personal history, patients have disturbed sleep, irregular food habits, and stress and strain from job and family. And the University of Abdominal Pelvis shows normal study, and her partner seminalized was normal. There was no relevant history from history. So we can see that the stress which was needed for the irregular cycle since 1 year, and thus the proper Nidana Parivarsana was planned, and patient was planned for classical variation. Next. So under the Nidana Parivarsana, the proper counseling was done with respect to food, habits, and lifestyle, and also advised to practice yoga, pranayama, and meditation regularly. And we also advised free from job for 3 months. And the treatment was classical variation followed by phalasarti orally for 3 months. So the parameters we can see: the stress, untimely food, disturbed sleep, poor appetite, and irregular cycle, which is leading to starter extinction. Next slide, sir. So here in the graph we can see after the Nidana Parivarsana and the classical Virejana and followed by the 3 months of the stress would have appetite and irregular or Dushtanta which came to Shuddha and other parameters came to Anasarosthi. Thus, patient conceived naturally on October 2015 and patient had uncontrolled pregnancy and she delivered healthy baby in 2019. So how we can understand this? To stress a factor in a female which is manifested first in her reproductive system, and we can see clearly in the menstruation. So we can say that stress will be acting directly on the HPO axis and which in turn affect the cycle that will be leading to irregular cycle, and there will be anovulation, and finally there is no conception, and again this is creating a stress. So this is a cycle which is happening, and the statistics also says that women with stress takes 29% longer to get pregnant compared to those who have less stress. So in this case, we have given the patient Kalyana Rudrada as Neha. So the drugs which stays clearly has the power of Shodo Dushti Hara, and all drugs have antioxidant activity. And the phalasarti also says Redasi, Aprajasti, and Virejana. Coming to Virejana, it is a Pitta Shamaka, and it is a Sharira Shodhana, then it is a Garbhashya Shodhana, and thus we are reaching to a Shuddha Artavakshya, and also it reduces the Pitta and stress. The phalasarti which is given 3 months already, the phalasarti of the phalasarti also says Pushte Vedam Palayat. So we can correlate it with correcting the HPO axis, and in turn, which is having a regular ovulatory cycle. The yoga, pranayama, and meditation, when we practice regularly, so it will activate parasympathetic nervous system, and in turn it activates relaxation. Thus,
Make it soon, doctor. Make it soon.
Yeah. Next. Thus, I wanted to conclude my session saying that understanding the proper course and breathing introduction always will be fruitful. Along with all other factors, Samanasya also is a very important conception and pregnancy to become successful. Thank you.
Thank you, Dr. Atira Lakshmi. The next presenter, Dr. Suman.
Hello, sir. Hello, sir. Am I audible, sir?
Yes, Dr. Suman, you are not visible, but आपका वीडियो ऑन कीजिए.
Yes, sir.
Yes, you can start.
Namaste to all. Myself is Dr. Suman, PTSR Department, National Institute of Ayurveda, Jaipur. My topic is a randomized clinical study to evaluate the effect of Dhatki Pushpadi Yoga along with Ashwagandha Grat in female infertility. Next slide, please, sir. Coming to introduction, infertility. Sir, please zoom slide, sir. Coming to introduction part, infertility is a global issue for all over the world. Infertility doesn't threaten physical health, but has a strong impact on psychological and social well-being of the couple. Factor responsible for infertility may be either male or female or both. Determining the root cause of infertility is a complex process, and it involves a lot of research and investigation. Two types of infertility are there: primary means primary and secondary secondary. Next slide, please, sir. Acharya and Shushruth has mentioned four factors. That is Ritu, Chetar, Ambu, and Bij, which help in conception. Next slide, please, sir. Aims and objective. Aims a randomized clinical study to evaluate the effect of Dhatki Pushpadi Yoga along with Ashwagandha Grat in female infertility. Objective is to evaluate the Dhatki Pushpadi Yoga along with Ashwagandha Grat in female infertility. Next slide, please, sir. Methodology: sample size 15 patients. Study design is open randomized clinical trial. Medicine: Dhatki Pushpadi Yoga and Ashwagandha Grat. Dose: Dhatki Pushpadi Yoga 5 gram with madhu twice a day before food, and Ashwagandha Grat 5 ml with lukewarm milk twice a day. Duration: that is of 90 days. Follow up after every menses. Next slide, please, sir. Observations: sample size that is of 15 patient. In that, 5 patient is of anovulation, 2 patient is of tubal factor, 3 patient is of cervical factor, 2 patient is of vaginal factor, and 3 patient is of unexplained causes. Next slide, please, sir. Coming to the result, 2 patient conceived of anovulation, 1 patient conceived of tubal factor, 3 patient conceived of cervical factor, and 1 patient of both vaginal and unexplained causes conceived. Next slide, please, sir. Coming to the mode of action of drugs, first of all, mode of action of Ashwagandha Grat. First, that is of Ashwagandha that possess Vata Shamak Balya Vrishya Rasayan or Vedna Stapan properties. Due to the Rasayan effect of Ashwagandha, it has mentioned in female disorder in Ayurveda. So it helps in obtaining best Ras Dhatu, consequently best Shonit or Artha Updhatu. A well-formed Updhatu contributes certainly in the achievement of conception. It helps in proper formation of follicle as well as maturation of oocyte. Britannia somnifera enhance follicogenesis and spermatogenesis and thus improve FSH and LH. And Ashwagandha Grat mentioned in Gadanigra and Falshruti Garb Sandhankam. Next slide, please, sir. Second drug is of Dhatki Pushpadi Yoga, which has the following properties. Kapha Pitta Shamak Daha Prashashmanam, व्रण रोपण और व्रण शोधन, योनि श्रावर स्तंभन संधानीय, बल्ले मेध्य गर्भ स्थापन, रक्त स्तंभक, रक्त पिथर और जंतुघन properties. और धात्की पुष्पादियोग फलश्रुतेज चिप्रम गर्भम युज्यते. So all of these and properties of both the drug helps in achievement of conception. Thank you so much.
Thank you, Dr. Suman. The next presenter, Dr. Jalpa.
Yes, sir. Am I audible?
Yeah, audible. Wait, let us see. Start the screen sharing in a
Okay.
while. Yeah. We can't see you, Jalpa. Have you started your
Yes,
video?
sir.
Yeah. Yes, you can go.
Okay, sir.
Start.
A very good morning to all and Jai Dhanvantari. Myself, Dr. Jalpa Patel. Today I am presenting the management of ovulatory infertility with special reference to hyperprolactinemia with Arthamatric Basti, a case study under the valuable guidance of Dr. Shilpa B. Dongavan. Next slide, please. Coming to the introduction, Prajananam Artham Sriyah Shrushtayah. Childbearing is considered as an essential role in woman's life, but due to various causes, there is a failure to conceive issue and infertility arises. WHO has been declared infertility as a global issue. Among the infertility factors, female is a direct response 40 to 55%. Among female infertility factor, ovarian factor comprises 35 to 40%, and among ovarian factor, as high as 9 to 17% women are suffering with hyperprolactinemia. As we all know, hyperprolactinemia suppresses GnRH release and there will be no ovulation, so infertility arises. Next slide, please. Coming to the Ayurveda review, Stanya and Artavar Upadhatu of Rasa Dhatu. Dhatu Pariposhan and Uttarotter Dhatu Upadhatu Nirman are continuous mechanical process which is influenced by Kedari Kulyana, Khalekapotna, Kshirdadina, etc. But due to Nidana Sevan, there will be vitiation of Tridosha, Dhatpagni Manta, etc. So there will be disturbance arises of this nutritional mechanical phenomena at the level of Dhatu and Upadhatu, and alteration in Stanya and Artav Nirman will be there. So it is said that Ekadeshe Vritti to Anyetu Shayah. Acharya Shushruth has also mentioned the 4 essential factors Dhana, Rutu Kshetra, Ambu Bija. Among them, Acharya Dalhan has stated Ambuhu Punar Ahar Pakacho Vyapi Rasadhatu. Stanya is a form from Rasadhatu. So, prolactin can be taken as a Sukshma bhag of Stanya, which form from Ahar Rasa. This Ambu also nourishes the Bija and Kshetra also. So, any of vitiation of this Ambu, which also will hamper the function of the Kshetra and the Bija also. So, hyperprolactinemia can be taken as the Ambu Dusti and also Rasadhatu Agni Mandya. There is Vimargaman of Artav due to pathological Shotorot of Artavaha Shotas, which caused by Rasadhatvagniman, result into Artakshaya and Sanyavruti. As we all know, physiological Shotorot is get after the Garbhadana, during Garbhavastha, and same as according to modern hyperprolactinemia affect the reproduction in 3 different compartments. First, it altered the GnRH pulsatility. Second, it's altered folliculogenesis, and third one is defective corpus luteum. All 3 together result into infertility. Next slide, please. Coming to the case study, patient named AX having age of 29 years old with active married life 5 years came at OPD with complaint of failure to conceive since 4 years, irregular and scanty menstruation since 2 years, and dyspareunia since 1 year. Her menstrual history was scanty, irregular, painful. Next slide, please. Next slide, please. Her personal history suggests that her appetite was poor, sleep disturbed, and stool was constipated. Their coital history was unsatisfactory with dyspareunia that 5 to 6 times per week. On general examination, physical examination. Next slide, please. On physical examination, systemic examination, and gynecological examination, there were no any abnormality detected. On breast examination, after pressing bilateral breast, milk extraction was found. The blood investigation were found within the range. Serum prolactin was found 42.86 nanogram per milliliter. There is a higher than normal range. And USG shows annulation since 2 previous consecutive cycles. Next slide, please. Consent was taken for prior to the study. So after detailed taking history of patient, some positive factors are get, that is Gurushita Ahar, Shamshana Adyashana, that directly leads to Rasavaha Shrotadusri. Viruddhashan Viruddhahar also leads to Ama Utpatti, and also Vandyatva is said to be Upadrava by Charakacharya. Vegadharan and Divaswap are also leads to the Rasavaha Shrotadusri. And according to modern, it increases sleep duration. By increased sleep duration, it increases serum prolactin level also. Chintanam ati chintana. This mental factor also leads to Rasavaha Shrotadusri. And according to modern, elevated serum prolactin level observed with stress. Acharya Shushit has mentioned Sanya and Shukra Srava by Sansparshat Darshanat Sparanda Apikriya also. According to modern also, increased frequency of stimulation of nipple and coital act increases the serum prolactin level. Next slide, please. So, treatment protocol. Sanya Pravruti is influenced by Vyanavayu. So, for its correction, Basti was selected for the treatment.
Make it soon. You have 1 minute.
Yes, sir. Counseling was done. Duration of therapy was 2 months. Acharya Vrundamadhav has mentioned Ardhamatric Basti, which possesses Sarva Rog Nirbaran, Rushya, Vata, Shonita, Nashan, Balavarnakara property. Ardhamatric Basti was given through rectal route after cessation of menses for 16 days or till ovulation occurs at morning with 480 ml dose. Next slide, please. Ingredient of Ardhamatric Basti having Dashmulak Yavud, that is Amapacha, Garbhashaya, Shodhan, Satpushpa is and Kalka, which are Agni, Deepan and Shoto Shodhan, and Puran Gud having Artojanan property. Next slide, please. Probable mode of action of Ardhamatric Basti. After giving Basti, Basti will spread all over the body through Shotas, which pacify the vitiation of a dosha and regularizing rest of the pitta and kapha karma, and it leads to amapachan and function of a proper function of Jataragni, remove avran and break artavaha shrotas, leads to samyak ahar rasa nirman, and sukshma bhag of rasa reaches to bija kosha, which leads to samyak artavan and sanya nirman, which leads to bijut sarga, and ultimately this improves fertility. Next slide, please. So according to modern also, Basti is after Basti enters into GIT, it stimulate ENS, which generates stimulatory signals for CNS, stimulate endogenous opioids, and release GnRH, which regulate HPO axis and regulate ovarian menstrual cycle. Observation and result. Before treatment, serum protein level was 42. The previous slide, please.
No. Time up. Last slide. Thank you. Good job. Thanks. Okay. Thanks. Yeah. Next.
Thank you, sir.
Good. Yeah. Thank you.
Thank you, everyone.
Yeah. Dear presenters, I'm very sorry. We have to stick on the time limit, that is 5 + 1 minute.
Okay, sir.
Yeah. Next presenter, Dr. Deepika. Dr. Deepika, are you there?
Yeah.
Can we see you, Deepika?
Yes.
Yes, you can start.
Am I audible?
Yes, absolutely.
Yeah, okay. Good afternoon, everyone. Myself, Dr. Deepika Shashikant Bey, final year PG scholar from Yeshwant Ayurveda College, Kodoli. My topic name is Comparative Clinical Study of Nakeshar Churna and Shatapushpa Churna orally with Bruhatital Uttarbastit Vandatva with special reference to primary infertility, guided by Dr. T. Vishala ma'am. Next slide, please. Introduction. Nature has empowered every woman to produce itself. The function of reproduction is the noblest. The nature has given the magnanimous gift only to female. Infertility is termed as failure to achieve conception by couple of mature age having normal coitus during appropriate period of menstrual cycle regularly, at least for 1 year. Infertility is termed as primary if conception has never occurred, and secondary if the patient failed to conceive after having a previous conception. Vandatva is also an independent disease, rather a cardinal feature of so many diseases. Essential factors of fertilizations are Rutu, Ambu, Bija, and Kshetra. Next slide, please. The aims and objectives. The aim is to study the efficacy of Nakeshar Churna and Shatapushpa Churna orally with Bruhati Taila Uttarbasti in Vandatva with special reference to an ovulatory cycle in primary infertility. And the objectives are
to promote the ovulatory cycle, to access the follicle development by TVS, to study the TVS by radiologists, to achieve the ovulation by 3 cycle of treatment, to ensure follicular development and timely rupture, to achieve the conception confirmed by UPT, and to access the synergistic of effect of oral churna with Bruhatitel Uttarbasti. Next, please. Methodology, study design. Comparative clinical study will be done on 40 clinical diagnosed patients with anovulatory cycle of primary infertility. They will be divided into two groups. Group A, Nakeshwar Churna with Bruhatitel Uttarbasti, and Group B, Shatapushpa Churna with Bruhatitel Uttarbasti. Conceptual study, a literature review will be taken from the standard Ayurvedic text and modern text on the basis of references. Next, please. Method of work, two groups. In group A, Bruhatitel Uttarbasti, Nakeshwar Churna. Number of patients are 20. The dose of Bruhatitel is 2 ml and Nakeshwar Churna is 4 gram, that is 2 gram twice a daily. And Kala of Bruhatitel Uttarbasti, 4th or 5th day after cessation of menstruation. And Nakeshwar Churna is Pratakal or Ratri Bhoj and Ratri Bhojanottar. The route of administration is Bruhatitel Uttarbasti is intrauterine and Nakeshwar Churna is oral, and Anupan of the Nakeshwar Churna is Ushnodak. Same as in group B, the Bruhatitel Uttarbasti and Shatapushpa Churna. Number of patients same, 20. Dose of Bruhatitel is 2 ml and Shatapushpa Churna is 4 gram, that is 2 gram twice daily. Kala, Bruhatitel 4th or 5th day after cessation of menstruation, and Shatapushpa Churna is Pratakal and Ratri Bhojanottar. Route, intrauterine and Shatapushpa Churna is oral, and Anupan of Shatapushpa Churna is Ushnodak. Next, please. Before Uttar Basti, one Kashay Basti and Dashamula Kwatha with Dashamula Kwatha 400 ml and Matra Basti with Tel 60 ml will be given. Patya Patya will be advised, same to both group. Study period is 3 cycle and follow up during treatment from 10th day to 20th day of every cycle. Follow-up after treatment is 2 months. Selection of criteria. Inclusive criteria, anovulatory cycle of primary infertility, PCOD, age between 20 years to 40 years, and BMI between 18.5 to 30. And exclusion criteria, secondary infertility, tubal blockage, endometriosis, congenital anomalies of uterus and adenexa, cervical immunological factor, husband sterility, hypothyroidism, tumor syndrome, PCOS, metabolic syndrome. Next, please. These are observation and result as per age, occupation, bowel habit. Next, please. Bowel habit, prakruti, socio-economical status, diet, religion, type of infertility. Next, married life, patient according duration of treatment. Next, these are parameters. Next,
You have 1 more minute.
Distribution of patient according to relief. Next, please. Next, Bruhatitel, previous one. Bruhatitel next, please. Yeah. Drug that is Bruhatitel on endometrium, stimulation of nervous arcuate nucleus, react on hypothalamus, GnRH, anterior pituitary, release FSH and LH on ovary, release estrogen and progesterone, that is ovulation. Next, please. Bruhatitel, Nakeshwar Churna and Shatapushpa Churna, I have given some Rasaguna, Virya, Vipaka and the drug of action. Next, please. Next. Conclusion, no adverse effect is noticed in both the trial groups, that is group A, Bruhatitel Uttarbasti with Nakeshwar Churna orally, and group B, Bruhatitel Uttarbasti with Shatapushpa Churna orally. Patient tolerated well the therapy, trial group A and B. Bruhatitel Uttarbasti with Nakeshwar Churna orally is effective as compared to the Bruhatitel Uttarbasti with Shatapushpa Churna orally. But as statistically, there was no significantly higher difference between the treatment group A and group B. Further study is needed with larger sample size, and the study, if restricted to only primary infertility, might give more specific reason. Thank you.
Yes, thank you. Thank you so much, Dr. Deepika Bendre. The last presenter for today, Dr. Divya Pawar. Dr. Divya,
Am I audible, sir?
you're audible.
Yes. Shall I start?
Yes, you can.
Good afternoon, respected teachers and presenters and viewers. I am Dr. Divya Pawar, final year PG student from SMBT Ayurveda College, Hospital, Igatpuri, Nashik, Maharashtra. I am delighted to be here today to give presentation on Ayurveda approach to diminishing ovarian reserve in female infertility case study under guidance of my guide and mentor, respected Dr. Samir Ghulab sir. Next slide, please. Introduction. Diminishing ovarian reserve is a condition in which the ovary loses its normal reproductive potential, compromising fertility and causing early menopause. According to Ayurveda, it is correlated with the Dhatukshayjanya Vandhya, explained in 40th chapter of Haris Sanhita, Tritiya Khanda, which deals with the Vandhyatva Roga, Lakshanas, and their treatment. DOR reflects with the rise in follicle stimulating hormone, decrease in anti-Mullerian hormone, and antral follicle count, etc. For a woman age more than 35 years, that can lower pregnancy rates to less than 5% and increases miscarriages rates to more than 75%. Aim and objectives: to evaluate the efficacy of Shamana, Aushadhi, Yoga Basti, and Yuttar Basti in the management of DOR induced female infertility. Next slide, please. Methodology. It is the case study of 35 years old female with a primary infertility due to DOR who had been treated with a Shodhana Chikitsa as a Yoga Basti, Uttar Basti, and Shaman Chikitsa simultaneously. The causes are the autoimmune disorders, iatrogenic like a chemotherapy, radiation therapy, uterine artery embolization, ovarian drilling, pelvic infections like varicella, tuberculosis, shigellosis, malaria, cytomegalovirus, chromosomal abnormalities, tobacco or smoking, tubal disease, endometriosis, prior any ovarian surgery, autosomal genes, chromosomal defects like monosomy. The pathogenesis of DOR is still obscure, but it can be due to decrease in primordial follicle pool, accelerated atresia of follicles, defective maturation, and recruitment of primordial follicle. Next slide, please. The clinical features of DOR are primary or secondary infertility, menstrual irregularities, osteoporotic changes, vaginal dryness, dyspareunia, hot flushes, sleep disturbance, mood swings, weight gain, and uterine prolapse. Next slide, please. The ovarian reserve test includes biological, biochemical, biophysical, and histological types. The assessment criteria we choose here was AMH if the AMH less than 1.5, basal FSH more than 10 to 15, and AFC count less than 10 in bilateral ovaries. Next slide, please. The case report: patient was of 35 years old, having a IT job. Her complaint was unable to conceive. Her menstrual history was like scanty flow with 2 to 3 days. She was married since 5 years and had 2 abortions with a D and E followed by first abortion. Her other history taken and found to be normal. Next slide, please. She came with her previous reports which were done on 21st January 2018, which were normal. Next slide, please. The treatment: counseling of the patient and her husband done according to dosha, avastha, koshtha, and kala, dipan and pachan done in the first. The shaman chikitsa started from the 10th of June 2019 till the 5th October 2019 with the phalasarpi, hingvashtaka churna, shatavari churna with the goghrita and manas mitravatakam of Vaidyaratnam. The above treatment given for the 4 months. Next slide. Shodhana Chikitsa started from the 10th of June 2019 till the September 2019 with a Purva Karma of Sthanik Snehana with a Balataila and Svedana with the Dashamula Kwatha, Anuvasan Basti given with a Shatapushpa Taila, Niruha Basti with the Mustadi Yapana Basti, and Uttar Basti with the Phalasarpi. All these 3 bastis given on the 5th day of menstrual cycle for consecutive three cycles. Monthly follow-up taken after every basti. Next slide, please. Observation before treatment, the FSH level was 15.2, AMH was 0.7, AFC in left ovary were 3, in right ovary were 2. The total impression was diminished low antral follicular count. Next slide, please. After treatment, the FSH was 7.83, AMH level was 1.2, and AFC was in left ovary, it was 9, in right ovary, it was 5. The total impression was increased antral follicle count. Next slide,
You
please.
have 1 more minute.
Yeah, yes, sir. According to Ayurvedic approach to Dhatukshay Jana Vandya, in terms of DOR, following events takes place. Nidan Sevana, that is Mithyacharana Tasrinam Pradushtena Artavinecha, Jayante Bija Doshascha Daivascha Shnuta Pruthak, which causes Vata Prakopa, Agni Vaishamya, Rasadushti, Artavadushti, which makes Sthana Sanshaya in Garbhashaya. Parikshina of Dhaturupi Artava takes place. Dhatukshay Janya Vandya is the diagnosis. The Chikitsa was the treatment protocol aims for the Shodhana and Shamana of Vata dosha and correction of Agni, thereby creating a equilibrium of doshas in Madhyama Avastha, that is elderly female. Next slide, please. Next slide, please. Hingvashtaka Churna. As it contains the Hingu, Jirakadvay, Ajamoda, and Sendav. Also, Hingu is Ingushnam, Pachanam, Rucham, Tikshnam, Vata, Balasahat, Shula Gulmam, Udara Anaha, Krimignam, Pittavardhanam, Sri Pushpa Jananam, Balyam, Murcha, Apasmara, Rutparam, which helps in the formation of healthy Ahara Rasa. This increases Rasa Dhatu, which works on the Annavaha Srutasa.
Yeah, you can come to conclusion soon.
Which is Manjishta Kushtatagara Triya. Okay, sir.
Come to conclusion. Yeah.
Next. Yes.
Yes.
So before
result.
slide.
Yeah, result. You can read the result and stop.
So result. Later on, the patient came with a 1 month, 5 month, 5 days amenorrhea on this 11 January 2019. The UPT was positive. Sonography done on 8th March 2019 showed regular gestational sac with 13 weeks plus 1 day gestational age. Placenta was anterior, amniotic fluid was normal. Patient delivered on 13 September 2019 with full-term normal delivery with a female baby of 2.9 kg. Thank you.
Yes, thank you. Thank you so much, Dr. Divya. Yeah, now I request both the chairpersons to kindly put your remarks on all these 8 presentations. Meanwhile, I'll be talking to the viewers here. By that time, you both can put your remarks as well as marks. Once after the putting the marks, you can WhatsApp me personally. And I request both the chairpersons to speak for 1 minute about all the 8 presentations. When one speaker is speaking, the other can mark the marks, then the other one while speaking, the other can mark and send it to me. So I will be addressing the viewers till then. Thank you so much, dear students who have sent your abstracts. We had received a lot of abstracts, almost maximum number of abstracts, and we could only accommodate 16 people. So congratulations to all those who have sent your abstracts firstly, and secondly, I would like to congratulate those 16 who could come up till here. It is not that the others were not good, but you had quite, I was more focused on clinical studies, as we are not a clinical branch. Prasuti is always a surgical branch. So more weightage will be given to clinical and surgical cases rather than the conceptual one. So as you all are in final year PG scholars, most of you, and that was the reason why we wanted only clinical studies, and that was the reason behind selection also. And I would like to congratulate Deepthi PV from Government Ayurveda College, Trivandrum, Dr. Srinidhi from SGV Ayurvedic Medical College, Bailahongal, Dr. Anita from Sumati Bhai Shah Ayurvedic Medical College, Hadapsar, Pune, Dr. Athira from Sri Sri Ayurveda College, Bengaluru, Dr. Suman from National Institute of Ayurveda, Jaipur, Dr. Jalpa from IPGT RA, Jamnagar, Dr. Deepika from Yashwant Ayurvedic Medical College, Kodoli, and Dr. Divya from SMBT Ayurvedic Medical College, Nashik. I also thank all the guides, the teachers of all the students who have sent their abstracts for making them do that and sending their abstracts. Thank you so much, all the guides and teachers throughout the nation of Prasuti Tantra and Stri Roga. So now can we have the chairman's remark? Asha madam, are you ready? Asha madam? Dr. Mamta madam? Yes, Dr. Asha madam is ready. Only the remarks, madam. Only the chairman, your remarks is needed.
All the papers.
Yes.
All papers are very nice. And actually, there is a tight competition between papers. They have come with different topics from various aspects of Stri Roga. And it was very nice. And I also here I congratulate this team, Viveka Prastuti 2020, for conducting such a wonderful scientific session, so that it will encourage the young aspirants of Prastuti Stri Roga. Okay, Shreyas.
Yes, thank you, madam. Now you can WhatsApp me the result sheet. I now request Dr. Mamta madam to give chairman remarks. Madam? Yeah.
Thank you, Shreyas. Really, the presenters have selected very nice cases for presentation. It has given us even the clinical glimpses where we can work little more, and their experiences also we can utilize in our practice. But some of the things, as they are students, I can put forth is some of them did not include what are the inclusion criteria and what are the exclusion criteria is one thing. Second thing, though the presenters were very nice, they failed somewhere to utilize their time properly. While a presentation is being made, what is the important aspect, what is not very important? So you have to categorize, and when you are running out of time, you have to see that you will rush to convey the important one, leaving aside whatever you have scheduled or what you have planned, right? That would have made presentation better in some of the presenters. So time, ultimately you have to keep in mind, so that your important marks will not be cut or reduced because of your poor utilization of time. And presentation wise, it was very good presentation. And even in scientific presentations, we do not entertain any other, like all pictures, colorful backgrounds, all these things. Even if it is blank, it is accepted, and it is expected to be like that, right? Colorful pictures and all in scientific presentations, we do not entertain, right? So I wish you all the best. It was a very good competition. Even I can say better than the live presentations. The virtual presentation quality was very good. Even I have to congratulate the organizers for selecting the papers which are worth presenting in this virtual meet. Good luck to all. Thank you.
Thank you. Thank you so much, madam. Yeah, now let's have the vote of thanks. Meanwhile, if Dr. Asha madam WhatsApp the report to me personally. And now I request Dr. Sangeeta, Assistant Professor of Prasuti Tantra and Stri Roga Department, Rajiv Gandhi Ayurvedic Medical College, Rohan, to propose the vote of thanks. Dr. Sangeeta?
Thank you, sir.
Yeah.
Yes, sir. Am I audible, sir?
Yes, yes, you are.
Yeah. A very good afternoon to you all. I deem it a great honor and privilege to propose the vote of thanks on this special occasion, Viveka Prastuti 2020. Let me first of all start by giving glory to the Almighty God for making today's occasion a resounding success. First and foremost, I thank our special guest, Chairperson, Dr. Mamta Ma'am, Professor, Head of Department of PG Studies in Prasuti Tantra and Stri Roga, Medical Superintendent SDM College of Ayurveda and Hospital, Udupi, who despite her busy schedule has found time to grace this occasion. Thank you, ma'am. And I also express my heartfelt thanks to Dr. Asha Sridhar, ma'am, Professor, Head of Department of PG Studies in Prasuti Tantra and Sriroga, Government Ayurvedic College, Thiruvananthapuram. Thank you, ma'am, for your valuable contribution. Now, I would like to thank our President, Shri G.S. Patil, sir, for his encouragement and continued support. I also extend my sincere thanks to our Secretary, Dr. K.B. Dhanur, sir, RGMC Roan, for your stewardship and encouragement. Now, I would like to thank Shri I.S. Patil, sir, our Chairman, RGS AMC Roan, for your encouragement and support. Now, I owe my special gratitude for our beloved principal, Dr. I.B. Kotur Shetty, sir, RGS AMC Roan, for his words of encouragement, and I also thank him for his kindness, his interest, and continued support. Thank you, sir. Now, I'd like to thank our organizing chairman, Dr. Shreyas, yes, sir, Associate Professor, RGS AMC Roan, for his valuable contributions, guidance, and encouragement in all our efforts. I also extend my gratitude to our scientific committee member, Dr. Bani ma'am, for her valuable contribution. I would also like to thank our organizing secretary, Dr. Navin Shisangi, sir, for his valuable support and contribution. Last but not the least, I would like to thank all presenters and viewers for your cooperation in making this occasion a resounding success. Thank you one and all.
Thank you so much, Dr. Yeah, thank you so much, Dr. Sangeeta madam. Yeah, now I will be asking Dr. Asha Sridhar madam to announce today's winner. Madam, I will WhatsApp you now the name of the winner. You can announce the name. Are you ready, madam? Asha madam?
Ready, Shreyas.
Ready.
Okay.
I will WhatsApp the name to you now. Okay, you can check your WhatsApp. I will WhatsApp in a minute now. Yeah, meanwhile, I would like to congratulate all of you. All of you have done an excellent job coming in a platform virtually and presenting it throughout the nation when whole world can also watch you on YouTube. So it is really a great mark that all of you have done your best, but there is marking for each and every point. So do not worry if you have not got that. You have done a very great job by coming and presenting it to the world. So I now, Asha madam, have you received the name?
Yes, I'll announce it now.
Yes, now I open the session for Dr. Asha madam, chairperson of Viveka Prasuti Tantra Department, to declare the result for today. Yes, madam.
Today's winner is Dr. Divya Pawar, SMBT, AMC, Nashik.
Yes, Nashik. Yeah. Thank you, Dr. Asha madam.
Congrats, Divya Pawar.
Yes.
Only a few difference in marks were there in between contestants.
Yes. Yeah. Thank you so much, Mamta madam, and thank you so much, Asha madam. So we will meet you tomorrow again at 11:30 a.m. So see you all with next other 8 presentations. All the presenters would be getting a certificate of presentation that you have done a national level presentation, paper presentation for this year. And Divya, congratulations from the management, principal, and staff, and the team of Rajiv Gandhi Education Society's Ayurvedic Medical College, Roan. See you all tomorrow.